The meeting will begin in about 4 minutes. Meeting will begin in about 3 minutes. The meeting will begin in about 2 minutes. All right, I have 2 o'clock. 2 o'clock. So we will get started. Tracy, you want to get us rolling?
Yes, good afternoon. Thank you all for joining us today from the Health Department to share our bi-weekly update on COVID-19 across the Lake Cumberland District. We have some members of our executive team will be answering questions that you all have submitted over the past 2 weeks. Sean, I'm going to turn it over to you right now and let you share an update.
All right, Tracy. We've had, by the way, Stuart and Dr. Raymond will be joining us in a minute. They're getting some tech issues worked out. So far in Adair County, we've had 807 total cases, 29 deaths, 73 released, leaving 105 active cases at the moment. with 98 of those isolated and 7 in the hospital. This is as of last night. There is in the red critical range of community spread, as is all of our 10 counties at this point. As of last night, they were at 72 cases per 100,000 7-day incidence, and it takes 25 per 100,000 to be in the red. Casey's had 495 total cases, 18 deaths, 440 have been released, 37 are still active with 35 isolated and 2 in the hospital. They have 50 per 100,000 spread right now. Clinton is 405 total cases, 9 deaths, 296 released, 100 cases remain active with 93 isolated and 7 hospitalized. They are having 118 cases, almost 119 cases per 100,000. So the community spread is most aggressive in Clinton County right now in our district. Cumberland County has 246 total cases with 0 deaths. 213 have been released, leaving 33 active, 28 of those isolated, 5 in the hospital. Cumberland has 73 per 100,000 7-day incidence rate. And again, it takes 25 to be in the red critical range. Greene has 503 total cases, 10 deaths, 439 released, leaving 54 active, 51 are on isolation, 3 in the hospital. They are at 100 cases per 100,000. Macquarie has 363 total cases, 1 death, 326 released, leaving 36 active, 34 on isolation, 2 in the hospital. They're experiencing 26.53 per 100,000 right now. So they were the last county to move into the red, and they just tipped over the 25 yesterday. So we'll watch Macquarie over the few days to see if they're going up or down. Pulaski has had 1,548 total cases, 12 deaths, 1,354 have been released, leaving 182 active, 168 on self-isolation, 14 in the hospital. Their community spread is 51.45. Russell's had 577 total cases, 10 deaths, 478 released, leaving 89 active, 83 on isolation, 6 in the hospital. Their community spread is 71.74 per 100,000. Taylor's had 887 cases, 8 deaths, 732 released, 147 still active, 144 isolated, and 3 still in the hospital. They're at 90 per 100,000 community spread. And Wayne, 538 total, 3 deaths, 401 released, 134 remain active, 130 isolated, 4 in the hospital. And they're having 99, 0.06 per 100,000. So all 10 of our 10 counties had an increase in community spread since yesterday. No counties were going down. So far today, we've had 172 new cases, with more to come before the evening for sure. We broke our single-day new case record yesterday by 1. Our previous record had been 109, which we broke or reached a few days ago, and 191 last night. So we broke it. We might break that record again today. When I say we have 172 cases, not all of those investigations may get completed today. Some of them, the investigation may roll to tomorrow. They just may not complete it and have to do it in the morning. So sometimes we don't report all of our cases. We report them on the day the investigation wraps up. The things of interest over the last few days, yesterday or the day before, had a conversation with one of the hospital administrators here who was concerned about capacity. This is the time of year when the hospitals have the most demand normally, flu and cold season. And with the added COVID strain on top of that, they have more COVID cases than they've had. They're stretched pretty thin. And it's not just a matter of space in the hospital, it's a matter of, do they have enough staff? I was told that when they reach out to the medical temp agencies to request staff to help relieve their demand, that those staff are unavailable, that every hospital and nursing home and, well, not, there's plenty of hospitals and nursing homes in the state that are drawing upon what few resources they are as far as the temp services, and not just in our state, but other states. So having enough personnel, medical personnel, can be a very real issue and something we should be very, very serious about. If the hospitals aren't able, Tracy, by the way, are you hearing me okay? The connection good? So if the hospital, is overwhelmed, it doesn't matter what you're trying to get into the hospital for. If they can't get you in, they can't get you in, if it's regardless of what your condition is. So this won't just impact COVID-19 related it'll impact anything you might need medical care for. I've also been told that the communities, as far as testing capacity for COVID-19, that's pretty well being maxed out right now, that it's difficult to get in for an appointment for a test. So that's becoming a challenge. So there's plenty of challenges right now. The biggest thing that concerns me is the hospital capacity. I think it was yesterday that in the governor's brief that the administrator from Pikeville Hospital made a plea about their capacity being stretched, and it looks like that's going to be a challenge all across the state. One other thing I will say, our growth rate, which is how long do we think it's going to take, or how long does the numbers suggest it will take for our total number of cases to double? Right now, our total cases, which we've accumulated since March over the last 37 weeks, is 6,369 total cases, which is just over 3% of our population. Our projected growth rate projects that that's going to double in about 28 days, or just under a month. So if you can compact all the pain that we've experienced over the last 37 weeks and imagine that all condensed into the next 28 days, you can start to get an idea for what the cliff that we're getting ready to go over with our exponential growth. Obviously, the health department can't deal with that. We don't have enough staff to contact trace and case investigate under those circumstances, and the hospitals very likely won't have enough capacity to respond either. So, we're really getting close to going over a cliff with this thing, and I'll say more about it as we get into the questions. Stuart, Dr. Wayman, do you all have anything to add? Tracy, anything I missed I should have covered?
I don't think so. I do want to remind everyone, if you have questions as we walk through our questions and you're on YouTube Live, please type those in the chat box and we'll do our best to answer those. I'm going to go ahead and start with the questions. First question is, what does the community need to do as a whole to make a difference?
All right, I think I answered this question. I think the issue right now is we need broad community response right now. I mean, we have too many examples of people that want to carve themselves out of the guidance and have an exception. What I mean by that is we have businesses that are resistant to enforce masking and social distancing. We have businesses that don't want their staff to be quarantined. We have schools that continue to have in-person instruction despite being in the red zone. We have churches that meet without social distancing and masking. We have the public, a number of people in the public, when they go out, they refuse to mask. All of these things together, when every one of these groups want to carve themselves out, there's a cumulative impact. And it's not, one group's not going to fix that. As communities, we have to come together, and all of these different pieces have to pull together. If we keep doing what we're doing, we're getting ready to go over a cliff. We can't we're not going to get a handle on this by everyone having the opinion that my piece of it, it's okay to carve my piece out. Let's let the problem be every place else. So, businesses need to enforce the social distancing and masking. Schools need to go to virtual instruction when they're in the red zone, when the counties are in the red zone. Individuals, when they go out, you need the social distance and you need the mask. I mean, it's going to take a broad community effort because what we're doing clearly is not working. And as I said, it's going to take us all. If everybody insists on their little piece of it being carved out and it don't apply to them, we're going over a cliff.
Okay, next question. Which domesticated animals can contract COVID-19?
So far, the ones that have contracted COVID-19 have been documented as cats, dogs, ferrets, and hamsters. None of them have shown any severe disease, and none of them have transmitted it to humans.
Okay, thank you, Dr. Wayman. Why is the virus affecting a wider spread of the population now, whereas in the beginning, so many of the cases, particularly in our area, seem to be confined to the elderly?
I think early on, there was a whole lot more respect for COVID-19. There was concern about COVID-19's coming out of China. Is it some sort of, bioengineered virus? There was all of that concern. And then the second place COVID-19 hit after China was Italy, and there was an extreme death rate in Italy. And we saw all the governments around the world, when they saw those two things together, the suspicion of it coming out of China and the death rate in Italy, almost every government decided to do a lockdown. And, and people in general were more respectful of the virus back then. So, of course, it showed up more in the elderly population. They were more vulnerable. But now, as people have lost respect for the virus and everyone wants their piece of the pie to be carved out, you want your business to be exempted from your staff being quarantined, or you don't want to enforce the distancing, or you're a school that's in the red zone that wants to continue to have in-person instruction, or if you're individuals that insist on not masking and social distancing. People have lost respect, and therefore it's much wider spread. It's impacting a much broader net of people. So it's just because there's more complacency and less respect for the virus now, which is surprising to me. We have in our district's numbers, we've had about 1 in 60 that have contracted it have passed away, and about 1 in 14 to 16. That number changes a little bit each day, but somewhere right in that neighborhood, let's say 1 in 15 end up being hospitalized from it. So, if we're adding 150 or 200 cases a day, you're talking about quite a lot of death and quite a lot of hospitalizations. That's why the hospitals across the state now are sounding the alarm. And we should all be very concerned about that. So, Dr. Wayman or Stewart, do you have anything to add to that?
You got it. And the more cases you have, the more cases you're going to have by virtue of connections.
And I do think, if people, we've been on here several months talking about this, and I know that people may be tired of listening to us, but, now that we see our hospital administrators coming out and saying these things, I mean, we really need to pay attention, because if the hospital's full and you go there for an emergency that's nothing related to COVID at all, you have a heart attack, not related to COVID, and you can't get in, and they don't have the staff to treat you, and you die, well, that was due to this virus causing that hospital to be full, and then they couldn't get around to you. So we don't want that to happen.
And Tracy, let me add before I forget. Last night I posted on our Facebook page a notice that if if you're one of the people in the public who is calling or emailing or texting the health department about complaints about the schools being in session, that you need to direct your complaints to the school leadership, because we don't have the authority in the health department to close the schools. By statute, it's Kentucky statutes. The schools have the authority to close the schools, not us. And one of the superintendents called me today to say they felt like that was kind of throwing them under the bus. And I apologize to them. That wasn't my intent. Our staff are very much overwhelmed right now. And taking over 100 complaints a day about school-related things is just an extra workload for an already overworked bunch of employees who are stressed to the point of almost breaking. And my intent was to direct people to the proper place to lodge your concern. So, I wasn't meaning to throw the schools under the bus. I was really just trying to divert those hundreds of calls we're getting, calls and texts and emails and social media posts a day that's complaints about that we really can't do anything about. So it's creating work for us that we don't have time to address, and the complaints are coming to the wrong place. They need to really go to the schools. So, I want to put that out there. And I want to say, I believe all of our schools leadership and our community leaders, I believe all their hearts are in the right place. I don't agree with having schools when the county's in-person instruction, when the schools are in the red zone. I think that's not the right public health stance. I don't agree with community leaders organizing large mass gathering events at this point in time. But I think their motives are good. I think their motives are misplaced, but I think their motives are good. I'm not trying to say that they're trying to do something mean. I mean, they care about their kids. They care about their communities. They're trying to keep them safe. It's not a question of people's intentions. It's really complicated. What's the right thing to do? And there's a lot of variables to take into account, not just the spread of COVID-19. I would say, though, at this point in time, when we're getting ready to drive the hospitals over the cliff with this thing, COVID-19 probably ought to start getting a little higher on everyone's priority list as what we're looking at as important. So let me get that out there.
Okay, thank you, Mr. Crabtree. Next question. Why are there such a wide range of symptoms, from respiratory problems to mental illness or mental issues, nerve problems, lethargic? That's yours, Dr. Wayman, maybe.
Well, the answer to this question is very complicated, but the short version is this, that it depends where the virus goes and what organs of the body it affects. So if you get a low dose of virus and it just goes in your upper respiratory tract, you're going to have a very mild illness and get over it. If you get virus deep down into your lungs and in your blood, and then it goes to your kidneys and your brain and your liver and wherever else you can think, your heart, then you are going to suffer from illness within those organs, which means you're going to have severe disease. Then the other part of this is your own immune system, and that's dependent on every individual. Either it's good, not so good, or overreactive. So if it's not so good, you're going to get sicker. If it's good, hopefully it'll take care of the infection and that'll be the end of it. And if your immune system gets to be hyperactive and ramped up, it will actually hurt you, even though the virus may be already gone. So there's a great range of pathology that can happen with this virus. And you can read a textbook on it.
Thank you, Dr. Wayman. Wow. Next question. Why does there seem to be a greater proportion of cases requiring hospitalization now compared to in the spring? You're establishing field hospitals that have now been struck.
Yeah, I look back, at least for the last several weeks or even months, our hospitalization rate has been very consistent. we've had about 1 out of every 15 people that get COVID-19 end up in the hospital. This was our number as of last night. So if we had 15 new cases today, 1 would end up in the hospital. 30 new cases today, 2 is very likely to end up in the hospital. 64 people. 120 new cases, 8 people. You know, right now we have 53 people in the hospital, and I think we had a high of 55. So, you know, and if we really do double in the next month, and you expect that 55 to go to 110, then our hospital capacity is in real danger. So we're at a concern. So it's not so much that there's a greater proportion of people needing hospitalization. That stayed pretty well the same, but there is a greater number of people needing hospitalization because there's a greater number of people by far who have COVID-19 active right now. So we are at, you know, one of our highest levels of active cases. So of those, when you've got that volume of cases, more people are going to need hospitalization. But the hospitalization rate's been pretty constant for quite a while.
Okay, thank you. Dr. Wayman, this may be for you. With multiple strands of COVID-19 already, how much confidence can we put in a single vaccine? Every year people have to be given flu boosters for those new strands. Would this disease not likewise require different vaccines for different strands?
So currently we do have something called a drift in the genetic composition of these viruses. It is not a shift. And that, to understand that, that just means less change versus a lot of change. If you have less change, you can continue to use the same vaccine. If you have a lot of change, you will need to reformulate the vaccine. So at this point in time, we're okay with the current vaccines. Now in a year, we may have to reformulate, just like with the flu vaccine.
So it may become something we need an annual
Correct.
vaccine for, like the flu, rather than a one-time vaccine.
Okay, thank you. Why is the mask mandate not being enforced? And what kind of mechanisms are in place to enforce it for individuals and businesses? Is that yours, Stuart?
Yep. So I think earlier Sean touched on our staff are at capacity. Of course, we have all our staff involved basically for the most part in case investigation and contact tracing at this time, and some few things that we do have to keep on doing. So we've taxed our staff out, and they are starting to be involved in the planning process for delivery of the vaccination, which we think is extremely important. When it comes down to enforcing those cases, so a positive case, we of course do that. We still have at least one person who is able to reach out whenever we do get complaints to talk to these businesses and to let them know that we are having complaints, and to encourage them to enforce the masking on their own premises. But there's just a few of us. I mean, there's no way for us to go out to all these businesses, all these factories, all these schools, et cetera, that we have in our community to try and enforce the mask mandate. So it's, you know, what we need is for everybody to take responsibility, every person, every business to take responsibility to wear those masks and to wash their hands and distance, and to encourage others who are not doing that to do so. I would encourage people, if you go to a store, if you do business at a place that does not enforce the mask mandate, don't do business with that place. The only way that we're going to lessen the effects is to get a vaccine, but we have to be in this together until we get a vaccine. So this is where we need everybody's help out there. It's not something that the health department can do by ourselves. I mean, if you're talking about enforcing Sewage leaks, yes, we could do that by ourselves. If restaurant inspections, yes, we can do that by ourselves. But when it comes to something this widespread, we can't do that without help.
Now, the public can be our greatest asset. The public can be our greatest liability. You know, it's going to take all of us taking this serious and taking precautions to keep from going over the cliff. And if we don't, we're going to go over the cliff. Clearly, what we're doing right now is clearly not working. Our growth rate is spiking, it's exponential, it's growing very quickly. Clearly, we have to change what we're doing, or we're leading ourselves down a very difficult path.
Okay, thank you all. Next question. Why aren't we currently in a lockdown? When we were in a lockdown back in the spring, when we had fewer cases, there were those were more isolated to nursing homes and assisted care facilities.
Yeah, I sort of alluded to this earlier. Now, if certainly if lockdowns were going to happen, it would make more sense to do it today than it did when we did it. You know, because the volume of cases is a whole lot higher now than it was when we actually had the lockdown. You know, as I said earlier, there was a lot of fear on the world scale early on with the skepticism and the confusion and the suspicion when it came out of China, and when it impacted Italy and there was that high death rate. You know, all of the governments of the world basically, you know, decided to lock down. They didn't want to see what happened in Italy happen everywhere. So, you know, the lockdowns came and went, and it was all under control for a while, but now it's really, really ballooned. So if you were going to do a lockdown, it would make more sense now. However, you know, we all understand lockdowns cannot be the solution to this. Society will crumble if you have broad-scale lockdowns. Financially, emotionally, societies can't long endure lockdowns. That does not mean that we do nothing. You know, that's why we keep saying everyone in our communities have to take some degree of ownership and responsibility for this. We have to find alternative ways to do things. You know, we need to go, when we go to the store, get in and out quick. We need to avoid, anytime you see groups of people, I don't care if it's a parade, a festival, a family event, you need to avoid groups of people right now. And when you have to be around people, mask and social distance. You know, if you're a business and you can work your employees from home, do. If you're a school and you can do virtual education, do. I mean, we need a community response to this. Continuing along this path of everyone feeling like their little piece needs to be carved out and exempted, we're just driving ourselves over this cliff. What we're doing is clearly not working. So, you know, would a lockdown be better now as opposed to when we did it? Yes. But lockdowns are not the long-term solution. Getting us to a vaccine is what we need to do as quick as we can, and that can only be developed as quick as the pharmaceutical companies can do it safely and it passes the FDA standards and approval process. But between now and then, we can save a lot of lives, and we can avoid hospitalizations if we will social distance, if we will mask, if our businesses, if our schools will observe the guidance, if our churches will observe the guidance, if we as a people will, you know, take this serious until the vaccine is around, we don't have to go over the cliff we're getting ready to go over.
Okay, thank you, Mr. Crabtree. Next question. What can you say to the perception that masks do not work as people are wearing them, but cases continue to rise?
Well, we do have lots and lots of data now that masks do work. The problem is that you have to have a majority of people wearing them for them to be effective. And unfortunately, we are, at least not in our communities, not seeing that. The countries that have had the best success of stopping COVID have in their culture wearing of face masks, during periods of high infectious diseases. China, South Korea, and various others. This is not new to them. They do this every year when it's flu season or major cold season. We used to laugh at them, thinking they were exaggerating, but they have been the most successful in this endeavor.
Yeah.
Something very simple, just wear your mask.
I was going to say something. My mind was drifting as Dr. Wayman was talking. Not that, what she was saying was absolutely important. I was thinking about the next point, though. Right now we have 6,300 and something cases, and that's expected to double in a month. So in a month, we could be at, let's just use our numbers, 12,000. In 2 months, 24,000. In 3 months, 48,000. In 4 months, was 56,000. So, 4 months times, we could be pretty close to the herd immunity for this disease, which may sound great. We can get this over with in 4 months, but what's going to happen if we take that fast track approach? We're going to have the hospitals absolutely shut down, tremendous amount of death that overwhelms the funeral businesses and the system set up to deal with death will be overwhelmed. Won't be able to deal with the death rate we have appropriately, and it'll just overwhelm the medical system. So we're talking about a tremendous amount of suffering that we can avoid if this thing doesn't double every 28 days for the next 4 months. So, getting this thing slowed down is really important.
It's going back on that last point too. I mean, most of the time when we hear people talk or quote some kind of source about the ineffectiveness of masking, it's some very obscure article that they're going to pull out and use for that. I mean, the science and the data overwhelmingly is on the side that masking does work, that masking maybe, it's not 100%, but I mean, we believe that it's 90+% effective. And even if there was, and I've learned this from Dr. Wayman, even if there is transmission, it seems to be that there is a much lower amount of virus that would be transferred, thus meaning a much lower illness, a much easier illness that you might have if you were infected by wearing a mask. But mask is the single most important thing that you can do to prevent yourself and others from getting COVID.
Think about the pharmaceuticals that are being developed right now are being, it is being said that I think one of them is up to 90% effective and one maybe 95% effective. So we have things in our power right now that's already, research shows 90% effective. What is that? If both parties are wearing a mask, keeping 6 foot distance, and you're not spending much time around that person, meaning that you have a brief interaction where you're not shouting or screaming or singing or anything that would eject a lot more particles, just normal talking, normal breathing, outside that 6 foot barrier, both person masked. We got a 90% chance or better you're not going to contract it that way. We already have the tools to be as effective as the vaccine. Now, once you have the vaccine, you can get back, you're not having to keep the 6 foot distance and wear the masks and avoid crowds. So that, societally, it gets you back to a much more level of normal, which is what we want. So the vaccine's the ideal. But between now and the vaccine, it is within our power to impact this. I see I have a message here. Is that from you, Tracy? Breaking up a little bit. How bad was it?
I think they understood well, and you're better now. You're good now.
All right.
All right. Next question. What is being done to see the mental health of the elderly people who are terrified of COVID-19 and isolated for fear of contracting the virus?
Yeah. This is one of several very, very valid concerns that people bring up. Just like, when a school administrator tells us that the kids don't have appropriate instruction when they're at home, that's true. That maybe the kids are safer, violence or family violence or when they're at school. Maybe they get better nutrition when they're at school. All those things are true. This is true. This is a valid concern. All of these concerns are valid. It's just you're as a society trying to weigh out which course are we going to take. Are we going to prioritize the response to COVID-19, or are we going to put these other things as a priority? I'm not answering the question, but I'm saying these things are valid and they create realistic challenges for us. As far as what the health department is doing to address this specific concern, we don't have the resources really to point at this particular issue. It would be something more appropriate for the mental health community or social service community to address. And, it's not really been something that we have the time or energy to focus on. Not that it's not a valid concern, but, we don't have the resources to direct toward that right now. My father's in a nursing home and he's isolated. We don't get to visit him and it's tough. It's tough on him. He doesn't understand. He's 90 and I can certainly relate to how challenging these issues can be. They're very real.
Thank you. Next question. And I think you've already answered this somewhat, Sean, but there has been a lot of controversy over schools being in session while in the red. Many think the health department should have shut the schools down. Actually makes that decision, and please explain the criteria used to determine red, yellow, and green.
The criteria to determine red, orange, yellow, and green has to do with your 7-day incidence rate. Meaning, if you're having 25 cases per 100,000, that would be the red. And I don't remember the breakdown. Let me pull up my other screen here. I've got that.
While Sean's looking for that, I'll go ahead and answer some of the other part of that question. So the health department does not have the authority legally to close the schools. I suppose that there are times we could get a court order to do something like that, but we do not have the authority to close them down in this instance for COVID-19. That authority has plainly been left up to, and clearly left up to, the superintendents and the boards of health to make those decisions. They also make the decisions about sports and
school boards, not the boards of health.
The school boards, I'm sorry. School boards, not the Board of Health, the Board of Education. They also make those determinations about sports and how those go on. So again, that kind of alludes back to our post. We always cooperate, we always work with the schools, but at this time, the recommendations, the red zone recommendations are, if you're a red county, that you should stop in-person schools and you should stop the sports activities. We encourage our schools to do that. And again, if you do have complaints related to that, the health department, we are not able to take care of those things. That's not something that we are able to enforce. So please reach out to your your schools to discuss your concerns with them.
So the only way that could change would be if the law changed to grant someone else the authority to close the schools other than the school board superintendent. It could be changed by an executive order of the governor. It could be changed by a local court order, or I suppose the county judge executive could declare a state of emergency and possibly close them down with the state of emergency authority of the local judge. So, but it's not a routine. None of those, all of those circumstances are very extreme. And, you know, it's the school boards that have the authority to do that. Now, the criteria, you're in the red critical range of spread if you're 25 or more per 100,000. You're in the orange accelerated range if you're 10 to 25 cases per 100,000. You're in the yellow range if you're 1 to 10, and if you're less than 1, you're in green. And now all of our counties are in the red critical range. Remember, 25 per 100,000 is the threshold. Our lowest county is Macquarie, that's 26 per 100,000. And our highest county is Clinton at 118 per 100,000. So we have some very aggressive spread in our region. Let me share my screen for a second, Tracy, and I'm going to show something here. Are you seeing the incidence map, Tracy? Okay. So what I want to show you this is our main statistics page. This pie chart right here shows you, since the onset of the outbreak, what's been the distribution of cases by age. And I just want to draw your attention that the pieces of the pie, we go in 10-year blocks, 80, 70, 60, down to, 0 through 10. But, the pieces of the pie are pretty even, which means that the virus, tends to attack the population pretty evenly, regardless of your age. Now, the result, this is the death rate. The more fragile you are, the more likely you are to die from it. The children age group, even though they have it, are the least likely to show symptoms. So they're the most likely group to have it and to be passing it without knowing that they're passing it. So that's a concern in the schools. When you have long-term care facilities or when you have jails, they routinely test their residents or their inpatient or their residents or their inmates. But, we don't no one's routinely testing the students in the schools to see how widespread the virus is. You may not see it in the kids because they're asymptomatic. You may not see it physically. That doesn't mean they don't have it and they're not spreading it. One of the things that I'm scrolling down to this pie chart, and today this donut chart, this just shows where people visited before they were isolated. And today it happens to be businesses, long-term care facilities, family, schools. So family is always going to be a high one. Long-term care has popped up because we've had outbreaks in 2 or 3 facilities. But for the last few days, businesses, schools, and family have been the largest area, which generally families is going to be your biggest area of spread. Now, why is that? Well, if you contract COVID-19 and you go home, you spend much more intimate and long-term. You have much more intimate and long-term contact with your family. So, of course, it's more likely to spread in home. It may be like if you're working somewhere where you're appropriately spaced and masking. But what I want to say about that is, and this is one of the reasons why some schools continue to stay in session, they say, we're not seeing it in the schools. And then of the school-age children, about half of it is really happening on our kids that are on virtual or home instruction. So the 2 things I'll say about that is you're not likely to see it in the kids physically. They're more likely to be asymptomatic. That doesn't mean they don't have it, and it doesn't mean they're not spreading it. It just means you don't see it in them physically. And as far as home spread, as I've talked about, that's the most likely place that you're going to spread it. But COVID doesn't originate in someone's home. They picked it up from the community someplace, and they brought it into the home. Where did they pick it up in the community? Well, most commonly, businesses and schools are trading places between first place as far as places that people visited while they were on isolation. So you're most likely you're either getting at work or it's being exchanged within the school system. And then it's coming home and it's spreading in the family. And of course, then it goes back out to churches and businesses and so forth. Well, my point is, you don't see the spread in the schools. You see the impact of what's happening in the schools in the community. Now, I'm going to stop sharing my screen. Now, I'm not saying schools going virtual solves the problem, because I'm not letting the rest of the community off like that. I'm not wanting to throw schools under the bus alone. I'm trying to throw the whole community under the bus, because the schools need to be virtual when they're in the red, just like the guidance suggests. Businesses need to be enforcing the masking and social distancing, just like the guidance suggests. When you go to church, you need to be either meeting virtually, or if you're going to go in person, keep your distance and social mask, just like the guidance suggests. And if you're an individual, wear your masks and avoid crowds. It's going to take a community response. We can't have this carved out approach where everyone feels like their piece of the pie shouldn't apply, because that approach is driving us over this cliff. And we're simply, as a community, we're going to have to do better if we're ever going to get our arms around this. So I don't know, Stuart, Dr. Wayman, you want to add anything to that?
I'm just that's the reason why it takes everybody. This is you've heard a lot of times about it. It takes everybody in a community to come together. I mean, this is one time it truly does. If we cannot come together on this, then the amount of suffering that we're going to see before a vaccine could be very devastating. And the proof is in the numbers. I mean, you don't have to, it's real. The math is there. You can believe the math.
Well, if you don't believe it, reality is going to teach us all something here in a few weeks if we don't step it up. So you're going to become a believer if you don't start believing now. The situation is going to make you a believer.
No, I don't think, and I think Sean and I were talking about this, and Dr. Wayman, I can't imagine right now that there is hardly anybody out there in our district or in our state that doesn't know someone who has had COVID, been in the hospital because of COVID, or passed away, or, currently, has had it in the past. I don't think that I don't see how there can be anybody out there. I mean, for a long time, I went for a long time without knowing somebody well. But now, just over the past week, because of such increases, I mean, I've known people very well, at least 5 people very well, who have been affected, and these people are sick. And these people are not people that are ready to die. These people are not elderly people. I'm talking about younger, vibrant people who are getting very sick. Now, yeah, they're going to end up coming out of it more than likely. But again, as Dr. Wayman said, the long-term effects of this, we're not sure what that's going to be. And even I see these people, once their 10 days is over and they're not shedding the virus anymore, they're still very tired and don't feel well again. So I mean, it's very rough. And if you don't know anybody, then it's not going to be long till you know somebody. It's going to really affect you personally.
We're getting down to our last couple questions, so if anybody wants to put something in the YouTube chat box, now's the time. Dr. Wayman, were you going to add something?
I was just going to say that I feel very sorry for the healthcare workers in hospitals and clinics. They are overworked and wish that the public would have some respect for them.
Yeah, I was talking with one of my department heads late last night about our staff in the health department being close to a breaking point because of the stress and the long hours and not having weekends off and things like that. And, you know, I don't disagree that that's true. Just in the last few days, I have also talked with hospitals that tell me their staff, they can't find help. They got people all sick. They're overworked, and they're nearing a breaking point. We've been on conference call with several long-term care facilities whose administrators tell us the same thing. My medical staff, they're stretched, they're overworked, they're about to the point of breaking. What I'm saying is, guys, we're at a very, very difficult spot right now, and if this thing doubles again in the next 28 days, if we can't get this slowed down, you know, a lot of these systems are going to break, and we just don't want to see that happen. So I don't know what else to say to make this more real to people.
I'm not sure. Okay, I'm going to go on with the next couple of questions, Sean, okay? This one is, Adair County the highest case number per capita in the 10-county region? I think you've already talked about that.
Yeah, I can say a little bit more about it. I mean, right, when I put this together last night, Clinton County was our highest per capita when we talk about 7-day incidence rate. They were having 114 per 100,000, and Adair was at 66 per 100,000. Those have been updated this morning, and Clinton is the highest at 118 now per 100,000. Adair's at 72. So we got several places per capita, or when you're looking at the 7-day incidence rate, that's ahead of Adair. Since the beginning of the outbreak, Greene, as of last night, had a total of 448 cases per 10,000, and Adair had 408 cases per 10,000. So as far as total cases, Adair wasn't in the lead there either. Greene was. So that kind of gets, and all this information I'm giving you is readily available on our website, either on our daily brief or on our main statistics page. So feel free to visit those sites and look for yourself and gather all the information you need.
Okay, and the next question. I know at one time there were limits on the number of people allowed in certain businesses. For example, at one time, the local Kroger store counted people to make sure they were not at their capacity. I assume that restriction is no longer in place, as I was at Kroger on Sunday and it was really packed. Also, I know there is no enforcement going on for mask mandate, but Kroger had more than half their customers not wearing masks. Will there ever come a time that businesses like this may face some kind of enforcement? I think you've talked about that already some too, Stuart, but I guess that's yours.
Yeah, okay, so as I look at my watch here, as of 2:54 today, Eastern time, restaurants, bars, and retail stores should still be limiting their occupancy to 50% capacity. So at 4 o'clock Eastern time today, we know that the governor is going to release some more recommendations, guidance, mandates. We're not exactly sure what those are going to be until he releases those at 4 p.m., but it is still 50%. Again, that the businesses, they must be a part of enforcing these. There has to be some self-enforcement. They have to ask their patrons to wear the mask. Of course, their employees should be wearing the mask. Again, I would say if a place doesn't do that, don't patronize that place until they do that. And as far as will there ever come a time the business is likely to face some kind of enforcement, it's possible. I mean, again, I don't know what the governor is going to come out with as of yet, but the there has to be a process put in place, such as Department of Labor being able to pull that license and to make it stick, or a fining process that is not such a fine that it doesn't matter. I mean, if we fine a large grocery store $25, I mean, what's that to them? We have to have significant fining. And then that fining has to be, it has to stick. So when those fines are made, then, they have to be imposed. So there would be a deterrent there. So as COVID worsens in the state, I mean, possibly there would be something that'll happen along those lines. But as of this time right now, we're not aware of what is going to happen, especially this afternoon. So we'll kind of see what happens this afternoon.
And we don't want to fine businesses.
No.
That we would rather businesses take responsibility and own this and understand, they're playing a part in what's going on with the spread of this disease, and to own it and to step up on their own and to, be an active player in preventing the spread. I'm frustrated to the point where if the fining system was significant enough to make a difference, I would consider instructing my staff to fine businesses. Like Stuart said, at $25 a pop, I don't think it's worth the trouble to create the conflict with our community partners for something that's not going to make an impact in the outcome of things. But don't want to fine anybody. That's it's not what we want to do. I don't know what to do to make this real to people, and I really hate to see us see this thing double in a month, and to see the consequences that's going to have for our medical community and for people that need healthcare treatment, for the number of deaths and stuff. I don't want to see that happen. I know since March we've been encouraging people to take this serious, and we're at the threshold here of a really, really bad spot. So I hope people will be energized and motivated to take this serious.
If individuals out there could show a little grace and a little kindness towards one another, and we wouldn't have near the problem that we're having right now. So, we just encourage people, but just please show a little bit of grace, show a little bit of kindness, put on your mask. It's not that big of a deal. It is an insignificant thing to do in the big scheme of life. It is very insignificant.
It's a insignificant personal inconvenience.
Right.
But it has a very significant impact in the spread. Yeah. Really slow it down. So I just want to reframe that. So
exactly.
I know what you're saying.
It's very important to do it, but in the whole scheme of things, I mean, wearing a mask is not going to destabilize your life because you've done that. We can do that.
It's a small price to pay.
Yeah, small price to pay.
For such a potential reward for our communities. Tracy, were there any other questions that came in? I don't see any on YouTube Live.
I have one, Stuart, if you don't care to address, Thanksgiving is next week. There's been some recommendations regarding Thanksgiving. Do you want to share those with everyone right now, just to remind them?
Yeah, so the recommendations right now, and as I'm going to go with the recommendation that we have now that we're going to be in this red zone. As you see, the state, I think last night maybe we had 13, 14 counties that are not red right now. The state's, out of 120 counties. So that means that, we're looking at 106 counties that are red in the state of Kentucky. So with Thanksgiving coming up, we advise that people have Thanksgiving dinner with their own household group, that you do not have these large gatherings, large family gatherings. I've heard so many people say or read that, you know, it may be my last gathering. Go ahead and have a gathering. It may be your last time with your mom, dad, grandpa, grandma, whatever. You know, it may truly be your last time when you bring COVID into that person. It may truly be your last time to have that Thanksgiving meal with them, or celebrate any kind of hot meal with them, or ever see them again. You know, it's the same with life at all. I know I could go out here and have a car wreck at any time, but the risk of COVID right now is so great in the community. The spread is so great. And we don't know where everybody's been. I mean, our family, we love and we trust these people, but we don't know where everybody's been all day long and who they may have been exposed to. And maybe this person is asymptomatic and, you know, they don't even know they have it. Or maybe in 2 days after Thanksgiving, they end up sick. Well, 2 days before that, that means that they were able to spread or to shed the virus, and have shed the virus to people that they had their Thanksgiving dinner with. Of course, you know, you're going to take your mask off, you're going to be eating, you're going to be talking and laughing, and the things that you do at these meals. I mean, we would like people to inconvenience themselves 1 year, one Thanksgiving, so that we can have next Thanksgiving together. We actually feel like if we don't do this, this spike is not going to end. Our case count is not going to stop. We need to have, if people gather for Thanksgiving, gather for Christmas, and gather for New Year's Eve, then these cases are just going to keep on driving up, and we're just not going to get a handle of this thing at all. I mean, if you think it's bad right now, then wait till we have a lot of get-togethers and people totally ignoring the guidance, and see how bad it really can get.
Yep. You know, it brings me no joy whatsoever to recommend that, you know, anyone not do anything that they normally would do, to say that, you know, your normal activities should be restricted right now. It brings me no joy. I don't like to be restricted either. If you think that we're getting some sort of entertainment out of encouraging people to follow the guidance, we're not. You know, we're saying this stuff because we believe it's going to save lives and save hospitalizations. And if you aren't paying attention to the different hospital administrators all across the state saying they're getting ready to have capacity issues, if that don't get your attention, I don't know what will. Tracy always says, what's your closing recommendations? You know, I generally close by saying, wear your mask, social distance, avoid crowds, wash your hands, you know, sanitize, which we all need to do. But I will add that, you know, everyone right now that wants to carve out their little part of this and say it shouldn't apply to us, guys, that is not working. If you're a school that's still meeting in person and you're in the red zone, you're contributing to the problem. You can justify it all you want, but you're contributing to the problem. If you're a business that's not enforcing social distancing and masking, you're contributing to the problem. If you're an event planner that's planning these mass gatherings, you're contributing to the problem. If you're an individual that's not wearing a mask and social distancing, you're contributing to the problem. And it's going to take us all to avoid this cliff we're getting ready to go over. And like I said, we just keep doing what we're doing, and everyone's saying, it don't apply to me, it don't apply to me, we're going over the cliff, folks. So I don't know how to make it any more plain. I'm sorry if that offends you. It does not bring me joy. I want this to be over. I've not had a day off since March. I got a lot of staff that's not had a day off in a long time, working a lot of hours. It's wearing us out. We want it to be over. More than anybody, we want it to be over. But, you know, the only way it's going to get over is if we all pull together.
You talk about a country who we love freedom, and we do. And Sean's comments made me think. I mean, we're not trying to ask you to take away your freedom. We are actually and truly trying to preserve your freedom. Because by wearing masks, by doing these things, it prevents the government, the governor from having to close these businesses, and so that you can have your freedoms. But right now, we just have to restrict ourselves and be a little patient, do the right thing, and we can get through it.
I guess that's it, Tracy.
All right,
Dr. Raymond, do you have any?
You have anything,
All right,
Dr.
close us
Wayman?
out.
Okay. Thank you all for joining us today. I do want to remind you to check out the website. There's all kinds of data on there, and it's updated daily. And if you have questions, please send those to us at the health department. We will have our next Zoom meeting December the 2nd in 2 weeks at 2 o'clock Eastern Standard Time, 1 Central. That's all I have. Again, thank you all for joining us.
Tracy, you forgot to remind them to get their flu shot.
Oh, yeah, I always do that too. But
I
do
was
get your flu
waiting on
shot.
you.
True,
You don't
true,
want,
true.
you don't want flu and COVID at the same time, so get your flu shot too. God bless
Okay.
you all. Have a happy Thanksgiving. Do it safely. We'll see you in a couple weeks.